Dr. Dev, it's lovely to see you. Could you just tell us a little bit about what you do and where you're based?
So thank you for asking me to talk. So I'm a consultant physician and a rheumatologist. I work at the Royal Oldham Hospital. I've been here for the best part of 12 years now as a consultant. I spent most of the last year looking after the medical patients on the wards. And my ward is GMU, the General Medical Unit, on the ground floor. We're a 27-bedded acute medical ward, and we've looked after COVID patients throughout the first and second waves of the pandemic. At the moment, we're looking after non-COVID patients, but that reflects the general shift in the nature of our admissions at the moment, and it's great to see that the COVID numbers of patients are actually reducing across both the community and also within the hospital. But it doesn't mean we're any less busy. We are still as busy as we would be at this time of the year. So it's a busy time for all my colleagues and the nursing staff and teams at the hospital at the moment.
Well, and I know many people want to express their thanks for all the care and so on that you and your staff have been providing. But tell me a little bit in terms of how things have been this year. I've been watching with interest in terms of how the hospital admissions have been varying over the last month or so. So it's, as you say, it's very good to see them coming down. But what has it been like this year with COVID compared to other years?
So I think this year's been different for everyone, of course, in all ways of life. The hospital saw a really sharp decline in admissions right at the very beginning of the pandemic when the first lockdown took effect. And it was the summer months. The weather was nice. Other admissions were far fewer to both accident and emergency and medicine. And then we started to see the steady and continued increase of the first wave of COVID patients coming in. And I guess for most of us, we hadn't really experienced this type of level of admissions with quite severe illness in a large proportion of the patients that we were looking after. And this seemed to happen really quickly. But as the lockdown of the first wave started to take effect, we started to see a leveling off and a sharp decline in those admissions. And thankfully, over the summer months, we started to return to life as normal, actually. And it was busy, but we were coping. And then over the last few weeks, we've seen a significant increase in the number of patients being admitted with COVID to the hospital. I think at one stage we had about 160 patients in the early part of November with COVID in the hospital. And gradually that number has started to decline. So we're now running about 60, 70 patients with COVID within the hospital. Our wards are full still, but that's really very much because it's business as usual. It's the usual conditions and illnesses that people get during the months of November, December, January. So we will continue to see that pressure, I think, on the hospital.
So what would your message be as we approach Christmas? Obviously, we're out of the second lockdown, but we do have some restrictions. But you know, with Christmas coming up and the ease of being able to see our families and so on over Christmas, what would your message be? Given that what you've said, that you know, in January we're still going to be having a huge demand on our health service.
Yeah, I think we have done a huge amount of work with the community, and I do thank the residents and people of Oldham and surrounding areas for sticking by the principles laid out by the government, because clearly that's had a massive effect on reducing our admissions. And the key really is to continue to abide by those measures that we've been adhering to over the last few months. Social distancing, adequate hand hygiene, minimizing contact within indoor spaces, and being sensible. As the Prime Minister has said, COVID doesn't know it's Christmas. COVID will not go away until we have a different way of dealing with it. And we just all have to be careful that we don't want a third wave. I certainly don't want a third wave in hospital. I don't think anyone wants to see that. And if we can keep and maintain levels of infection as they are, I think we'll probably have a fighting chance of surviving the next few months in hospital and in the community, with our community services being already under a lot of pressure as it is.
Absolutely, and we've got the light at the end of the tunnel with the vaccine, or one of 3 different options of vaccine that may be available.
People have been vaccinated, and I'm really pleased that the Northern Care Alliance, who runs and supervises Oldham as a site, have really the first dibs at getting hold of the vaccine, and hopefully that will be a real game changer in both protecting our patients, staff, and the people who look after both groups in the community and in hospital.
Fantastic. Dr. Dev, thank you so much. It's been lovely to meet you. And again, apologies for the hiccup earlier.
Okay, no.
Stay safe. All the very best.
Take care.
Thank you.
Bye.
Bye-bye.